Hello, my name is Sabrina Ladd. Today is March 24th, 2026, and I'm here to do my dehydration screen and my urinary incontinence screen. This is my patient, Shabria. She is 26 years old. We are going to talk about dehydration first. So to assess for dehydration, we will inspect her mouth, her oral mucosa. We will look for signs of dryness, which is cracking, dullness, and just like dryness around the mouth. For her eyes, we will look around to see if they're sunken in her skin turgor. We will check for tinting, which are all signs of dehydration. So I'll start with asking you some questions. How are you today?
Good.
I will now ask you about your oral intake. How much fluid do you take in daily?
3 48-ounce bottles.
3 to 4 8-ounce bottles.
Mm-hmm.
Have you had any vomiting or diarrhea lately? And do you take any medications that will cause you to urinate, like Lasix, any diuretics?
No.
Okay, so then we're going to move on to the assessment. We're going to look in your mouth to assess, to make sure that you're not dehydrated. So I'm just going to have you open your mouth, please. Stick out your tongue, which it is moist, it's sticky. Your mucosa is shiny in there. Smile, let me see. And your mucosa up here is dry. It's moist and shiny. That's all good signs that you're not dehydrated. And last, we will check for tinting on your skin. So you just hold your hand out and you pinch up like that, and you have no tinting. If it stays up, that means it's signs of dehydrating. And orally, your sclera is white, and you are not sunken in around here. Those are also signs of dehydration. Do you have any questions?
Nope.
And next we will move on to the incontinence. Screening tools for dehydration is the Texas Dehydration Risk Assessment tool. It's done quarterly, and it has a bunch of questions that you ask to check for dehydration in elderly people. And then we also have the Gulp Dehydration Risk tool, and it's a 3-question thing, and it comes with a care plan depending on what your score is. It'll give you a score, low, medium, or high risk, and then it comes with a care plan and tell you what to do depending on the score. So that's the Gulp assessment, and that's the Texas assessment. The screening tool we are going to do is the urinary incontinence screening tool. It's composed of 3 questions. During the last month, and you have options, yes or no. Depending on the answer, you stop or you keep going. I'm going to ask you about urinary incontinence. Are you comfortable with that?
Mm-hmm. Yes.
So the first question is, during the last 3 months, have you leaked urine, even a small amount? Yes or no?
No.
So our answer is no. So we would stop there according to question 1. So we don't need to complete the other 2. If the answer would have been yes, we will go to the next question, which is, during the last 3 months, did you leak urine? Check all that apply. And then the questions are, when you were performing some kind of physical activity, such as coughing, sneezing, lifting, or exercise, when you had the urge or feeling that you needed to empty your bladder, but you could not get to the toilet fast enough, or without physical activity or a sense of urgency. And then question number 3 is, during the last 3 months, did you leak urine most often? Check only 1. And the options are, when you are performing some physical activity such as coughing, sneezing, or lifting or exercise, when you had the urge or feeling that you need to empty your bladder but you could not get to the toilet fast enough, without physical activity or a sense of urgency, about equally as often with physical activity as without. So that's the urinary incontinence screening tool. Do you have any questions, Ms. Jabria?
No.
Thank you for being my patient. Thank you all for watching.